Okay, hi guys. In this video, we're going to be taping for tennis elbow. Tennis elbow is the commonest elbow injury. All right, it usually involves pain at the edge over here. Okay, and that pain can sometimes run down the elbow or down the arm into the actual wrist. You get some pain shooting down. This very commonly occurs in people who are playing sports like racket sports, badminton, tennis, squash, and of course people who are doing heavy weights, and people who start to do some weights that they've never done before. Sometimes if you go to the gym and you've never lifted a weight for the next 3 or 4 days, it's really painful. That can trigger a tennis elbow. We call it a lateral epicondylitis. What that means is this is the lateral epicondyle. All right, on the inside is the medial epicondyle. So you'll either have commonly what we refer to as a tennis elbow, because tennis players traditionally used to get this, or if it's on the inside, it's a golfer's elbow. But as a golfer, you can still get tennis elbow, so it's a little bit confusing. All right, but either pain on the outside or the inside of the elbow is a very similar condition. Basically, all the muscles that extend Michelle's wrist all form a common extended tendon that attaches onto here. Okay, all the muscles that flex or bend, all right, Michelle's wrist, all attach at the common flexor tendon on the inside of the elbow. So when you have activities that flex or extend, okay, that's where you're going to get these injuries. So today we're going to teach you how to tape for a tennis elbow. It's very simple to do. Okay, basically what you do is, firstly we need to measure and cut. All right, so that looks to be okay. All right, we're then going to round the edge. This is really important so that it doesn't get caught on any clothes. Okay, and then what we're going to do is we're going to split it. Now the reason why I split it is because you get to cover a greater surface area of the tendons if you split it. Some people don't like splitting it, but I think this is, in my experience, splitting seems to help. Okay, we're going to round the edges, and here. Okay, then we have this ready. So again, this is a taping for a strain of the elbow. So if the tendon is strained, that means the muscle has been overactive. We want to get the muscle to chill out and relax. Okay, therefore, again, we're going to tape from away to the middle. We're going to deactivate this muscle. So very simply, you just tear with your fingers. Try not to touch the sticky part. Okay, we're going to put it down in neutral. Just cover the wrist. Okay, just like that. Put it down. Rub it a little bit to activate the glue. Okay. Then what we're going to do is, remember, for kinesiotaping to work, because it works on the nervous system, we must tape in a stretch. Okay, keep your wrist bent. It's actually stretching these muscles here. So we're going to run onto the inside here at about 50% of the maximum stretch. We're going to put that down, and the rest we're just going to put down without any stretch. This stops it from peeling off too easily, which is a common problem with kinesiotaping. Same thing here, we're going to go more towards the outside. And we're going to come towards the same area here, okay, which is towards the origin of the tendon. And again, we're going to rub that just to activate it. Okay, that's the taping for a tennis elbow or elbow pain. One thing I do like to do, all right, is add a little bit of a supporting tape to this technique. Okay, and basically what we do is we just cut a little bit here. Okay, again, we round it. And if you really want to be funky, you can put different color tape on. Okay. And what I do is, okay, is we are going to try and just tape her a little bit like that to take the pressure off the tendon. So I'm going to try and pull it up and support her a little bit. So all we do is we just do here. This one, you don't need to bend anything. We're just going to start over here on the inside of the elbow. There. Okay. I'm going to get her to bend that a little bit. And then what we're going to do is we're just going to kind of pull the skin across, all right, and then put the rest down without any pull. Okay, so what I'm doing there is that I'm just trying to pull the muscle and the tendon closer to the bone so it's not pulling anymore. So that's a nice little elbow technique for you to do. For the golfer's elbow, it's exactly the opposite. Okay.